I'm Michael Bronson, and I practice by myself here in general dentistry. This is our scratch practice, Bronson Dental. Hung the shingle out, and we've been here for about 6 years. If you're looking at purchasing a curing light, definitely one that you'd want to look at is one that had a broad range. The VALO certainly has that range to cover all composites, all materials that need to be cured. You definitely don't want to limit yourself on your range of what you can cure.
My name's Kira. I've been a dental assistant for about 3 years. From my standpoint, I like using the VALO because it is so lightweight and the button is easy to find. On some lights I've used, it's kind of hard to get your finger on the button and push it without moving it, and I think that part is great.
There's two choices of which button to push, so it's pretty simple. And if you hit the wrong button, you hit it a couple of times and you're back to the mode that you want to be in. One thing I always think of the advantage, because especially like doing sealants, it seems like kids, they come in after lunch, their saliva juices are going. I mean, if you've got a cotton roll and you've got a dry angle in there and you're trying to get the sealant on there, and you've only got a few seconds before the water starts pooling up and that tooth is submerged. With the normal curing light, you've probably got to get another dry angle, another cotton roll, and hold it there for a little bit longer. But the VALO allows you just to kind of get it done and have it cured before that water comes up over the tooth. I'm always amazed when, even just trying to get back to a second molar, it seems like you have to have the patient open up a little bit wider to be able to get in there to cure with another curing light. With the VALO, I mean, you don't need a whole lot of room to sneak in there and cure even on a second molar. Even on a wisdom tooth, we were doing a wisdom tooth the other day, and I mean, there's not much room back there. Most curing lights probably wouldn't do it, but the VALO can get back there.
It can get in the smallest patient's mouth, and someone with TMJ problems. It is a lot thinner than any light I've ever used. I have dropped other curing lights before, on 2 instances, and one, the battery actually broke out and we couldn't fix that, so we had to get a new one. And the other, the light actually broke. So the durability on the VALO is a lot better than that.
You know, if there's any dentist that's looking at getting a new curing light or even trying to upgrade, I would definitely recommend the VALO.
We've been using VALO for about 6 months, and we wouldn't let anyone take it away.